Welcome to Season 5 of Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health. I'm Joshua Sharfstein, Vice Dean for Public Health Practice and Community Engagement and a former health commissioner here in Baltimore, Maryland. Our goal with this podcast is to bring scientific evidence and experience to shed light on critical health issues. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Today, I speak to Dr. Wojtek Szeklik, an anesthesiologist and intensive care physician from Krakow, Poland. We speak about how his hospital and his city are adapting to the arrival of hundreds of thousands of Ukrainian refugees and are readying themselves for military casualties. Let's listen. Dr. Wojtek Szeklik, thank you so much for joining me on Public Health on Call from Krakow, Poland. How are you doing today?
I'm doing well, thank you. Thank you for having me, Dr. Sharfstein. Thank you.
So why don't we start by having you explain a little bit about your job and your hospital in Poland.
So I'm a doctor in Krakow, which is a city in the south of Poland, around 800,000 citizens, so third largest city in Poland, and actually one of the closest large cities to the Ukrainian border. It's about 3 hours drive to the Ukrainian border. I'm an intensivist and anesthetist, but with a general medicine background, and I chair a department of anesthesia and intensive care in the military hospital in Krakow, which is one of the largest hospitals in Krakow. And in the same time, a hospital which is supposed to hospitalize the war casualties once they are able to transport the patients to Krakow. What I do in terms of clinical practice.
Yeah, well, it sounds like a lot that you do, and it sounds like your job has changed somewhat over the last few weeks. What has it been like for refugees to be coming to your city?
So, Josh, it's like it's really hard time because in 3 weeks we actually welcomed about 2 million or more than 2 million of refugees in Poland, which is a huge number. Poland being about like 38 million, so a large group of people coming to Poland. Just to give you an image, like how big number it is when we think of the Syrian crisis, the amount of Syrian refugees that came to Germany was about like 1 million in a year period. So it's a huge number of people coming here and in a very short time period. So what we're seeing now is actually the refugees everywhere and flee out of Ukraine, which is under the war, and actually the conditions under which they run away from the Ukraine are very difficult for them. It's usually difficult transport, a lot of time spent in the way, not in good conditions, and a lot of these people are older, are sick, need medical help. So we're seeing a lot of new admissions, both to outpatient care and to hospitals.
And how many of the refugees have come to Krakow?
It is about 200,000 of refugees. So 1/4 of the population of the city is actually with the refugees. These are the refugees now. And this is the same for large cities in Poland. Other cities like Warsaw, it's 25% of the population increase in less than 2 weeks. So it's really quite a great burden for the whole society.
Yeah, it's really hard for me even to imagine, but certainly the healthcare system is at the front lines of trying to accommodate so many more people. You mentioned that you are able to take war casualties, but not at this point. You haven't done that yet. So what are you seeing in your hospital so far from the refugees?
We're mostly seeing patients that are exacerbated in their chronic diseases. So older people not having their medications, dehydrated, tired, in enormous stress, both psychological and physical, actually. So very often these interventions are like quite obvious, just giving fluids and maybe giving them the medication that they use every day in the past time. The second thing, which is like quite common now, is like we're starting to see again like COVID patients as COVID is more common on Ukraine than it is in Poland now, and less people are vaccinated. It's not more than 30% of the population vaccinated against COVID in Ukraine. And we're definitely seeing a lot of chronic diseases that need constant healthcare. Out of this 2 million refugees, about 800,000 of children that came here. These refugees are actually almost only women and children. The men are fighting. So one of the first, refugees that came here were the chronic disease patients. So children with either leukemia or cancers that needed immediate treatment. So a lot of new admissions to hospital as well in chronic diseases.
I wanted to circle back on something you said about the mental strain on people who have left their homes, unsure whether they can go back, may have loved ones who are fighting or lost to them at the moment. Is there anything that your hospital is able to do to help? What is the approach to addressing that serious burden?
So I think hospital for sure is an important place, but what is even more important is that the attitude from the citizens all around is very friendly, very generous, very compassionate to these people coming. So a lot of people give whatever they can to help them and try to make the life here in this time at least a bit similar to what they used to be, or a bit more in family conditions. But what we're seeing here in hospitals is a lot of psychological help which is needed. And we're quite lucky because before the war, there were about more than 1.5 million of Ukrainians already living in Poland. Furthermore, the language is a Slavian language, so often we can somehow communicate between each other. And so we're having a lot of Ukrainian friends that help us in communication. We're having this, common body language and some similar words. So we can help in difficult discussions. But it's definitely an important part of our job now, all this psychological help.
Absolutely. And in terms of preparing for military casualties, you said you were a military hospital. Is there anything in particular you have to do to get ready?
So we are all the time waiting on our positions for these patients to come since the very first day. The problem is that it's quite a far away, actually, that the military action, the war is going on in the north part mainly and the east part, which is quite far from our border. And the Russians are not allowing this humanitarian tunnels or passages. They only say that the one that people can go, the one that person can go to in the direction to Russia, which is quite we can understand it. But anyway, so it's we're not seeing many of these patients. We had some starting last week that were treated in Ukrainian hospitals and came here after the first surgeries and probably for a longer stay in hospital. But what we're doing now is we are preparing extra places for these patients. And just to give you an example, my ward, which is intensive care, we usually have 11 beds in service. And we already prepared and are ready for another 10 for the casualties. And the same for anesthesia. We are increasing the staffing. We are increasing all the emergency equipment and trying to be prepared for the immediate transports with the one that people coming here.
Well, this must be an incredible challenge for you and your colleagues, especially after 2 years of a pandemic.
We're really hoping to catch a bit of rest after these 2 years, but it doesn't seem like. Actually, the pandemic helps a bit because some of these patients are treated in this field hospitals which we had for COVID. We are, after these 2 years, quite used to expanding our capacities in terms of medical resources. So, and this war just came after we're leaving the last COVID Omicron wave. So we thought it's almost over and now it's the war. So yeah, but in a way it helps us in the organization of health service now.
Well, I certainly appreciate that you are part of the reason that so many refugees are able to, move forward in Poland right now, despite the incredibly difficult circumstances. I understand that you are raising money for some of the refugees, for some of their efforts. Is that true?
It's like it's actually happening all around here with the help from citizens, but also from large organizations. This is enormously helpful, like in terms of the daily living of the Ukrainians here in Poland, but also for the health service as well. So we're getting quite a good support from like both the government, but mainly actually from the humanitarian organizations. And this is very helpful. Yeah. Our hospital is actually raising money for the war casualties and to prepare ourselves for the upcoming crisis. And I can send you the link to this action, Josh, if possible. Yeah.
Sure, absolutely. We can put it in the notes to the podcast. Thank you. Any final thoughts about your role and the role of more generally people in Krakow to what is happening?
Josh, I think it's like the main thing is like I'm so impressed with the attitude of people that welcomed all these refugees and very often like sharing their houses, bringing baskets with food or toys or just like sharing a good word. And also with the attitude and help from our friends from several other countries and from abroad. As we're discussing today, it's like there's a great interest in like how to help both the Ukrainians and the Polish side as well to accommodate the refugees. So I would just like to say thank you to all of you. Yeah.
Well, thank you very much for joining me and talking to Public Health on Call about your experiences.
It was a pleasure. Thank you.
Public Health on Call is produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by Niall Owen McClusker, Matthew Martin, Spencer Greer, and Holly Cardinal, with support from Chip Hickey. Distribution by Nick Moran. Production support from Catherine Ricardo. Social media support from Grace Holz Fernandez. Thank you for listening.